COVID-19 mRNA vaccines for children. Frequently asked questions. What vaccine will children be able to get? Pfizer-BioNTech, also called Comirnaty, is now approved for children aged 5 to 11. Health Canada is reviewing the MODERNA or SPIKEVAX vaccine for approval. Will children aged 5 to 11 get the same vaccine dose as teens and adults? The Pfizer mRNA vaccine for children contains a lower dose. The vaccine used for teens and adults contains a 30 microgram dose. The vaccine for children contains a 10 microgram dose. Smaller vaccine doses are used in children because they have stronger immune responses than adults. Should children who weigh more or who are nearly 12 get bigger doses? Vaccine doses are never based on weight, so children who weigh more or who are almost 12 years old do not need a bigger dose. Children turning 12 between doses can get a 10 microgram or 30 microgram dose for dose 2. How many vaccine doses will children receive? The National Advisory Committee on Immunization recommends 2 doses of a Pfizer vaccine for children, 8 weeks apart. This may give better long-term protection. What is in the Pfizer mRNA vaccine? The Pfizer vaccine contains mRNA wrapped in a lipid or fat envelope. The lipid envelope protects the mRNA while it is getting to the cells. mRNA instructs your cells to make the COVID-19 spike protein. The Pfizer vaccine for children has slightly different sugars and salts, so it can be stored in the fridge longer. The vaccine does not contain any COVID-19 virus. It cannot cause a COVID-19 infection. Is mRNA technology safe? Vaccines are safe. Scientists have been developing mRNA therapies since the 1960s. Scientists around the world worked together to create mRNA COVID-19 vaccines. The vaccines were tested in clinical trials, and trial data was reviewed by regulatory bodies before vaccines could be used. Strong vaccine safety systems monitor for rare vaccine side effects. As of October 2021, more than 1.4 billion doses of Pfizer COVID-19 vaccines have been delivered around the world. Can my child still get the vaccine even if they already had a COVID-19 infection? Children who have had a COVID-19 infection can be vaccinated. Children who have had multisystem inflammatory syndrome should wait to be vaccinated for at least 90 days after diagnosis. Do mRNA COVID-19 vaccines work for children between 5 and 11? In vaccine trials, children had a strong immune system response to the Pfizer vaccine. Children who got 2 doses of the Pfizer COVID-19 vaccine had a 91% lower chance of getting sick with COVID-19. The Pfizer vaccine protects children from getting sick with the Delta variant. What are the benefits of getting vaccinated for children? Getting vaccinated lowers the risk of getting sick with COVID-19. Getting vaccinated may lower the risk of long COVID. Children who are vaccinated have a lower chance of spreading COVID-19 to classmates, friends, and loved ones. Vaccinated children are less likely to have to miss school or activities if they're exposed to someone with COVID-19. Getting vaccinated will let children get back to enjoying many of the things that they have missed. This includes sports, choirs, clubs, and sleepovers. What are the common side effects of mRNA COVID-19 vaccines in children? Many children in the trials had mild side effects after getting the Pfizer vaccine. Side effects went away after a few days. The most common were arm pain and redness, tiredness, chills, and muscle or joint pain. What are the serious side effects of mRNA COVID-19 vaccines in children? No new serious side effects were seen in the Pfizer vaccine trials for children. Serious side effects like anaphylaxis, a severe allergic reaction, after mRNA COVID-19 vaccines are very rare. It is very unlikely someone with allergies to food, drugs, insect stings, or other vaccines will have an allergic reaction to COVID-19 vaccines. Inflammation of the heart, called myocarditis, and of the sac around the heart, called pericarditis, happens rarely after COVID-19 vaccine administration. These conditions are usually mild after COVID-19 vaccines and are much more common after a COVID-19 infection. For more information, speak with your primary healthcare provider or your pharmacist. What are the long-term side effects of mRNA COVID-19 vaccines in children? Like other vaccines given to children, experts do not expect mRNA vaccines to have long-term effects. The mRNA in the vaccines is completely gone from the body 2 to 3 days after each dose. The mRNA vaccines do not affect fertility, genes, DNA, or hormone levels. Most people are expected to be exposed to COVID-19 within a year. COVID-19 infection can cause serious illness and death in any child. COVID-19 can cause myocarditis and pericarditis. Multisystem inflammatory syndrome is most common in children aged 5 to 11. We're still learning about long COVID. In early studies, 1 to 4 out of every 100 children with a COVID-19 infection had lasting symptoms. That's 1 to 4%. Children can get long COVID even after a mild illness. How can I support a child who has a disability or specific needs? Some children may need specific supports to access COVID-19 vaccines. Parents and guardians can talk with their healthcare team to make a vaccine plan for children with more complex needs. Many healthcare professionals, infectious disease scientists, and public health experts are publicly declaring now that they'll get their own kids vaccinated as soon as possible. The vaccine for children is safe and effective, and there are so many benefits. Let's get all kids back to being kids. The information found in this video was taken from the Focused COVID Communication Frequently Asked Questions COVID-19 mRNA Vaccines for Children sheet. Doctors, scientists, pharmacists, and patients in Canada made this guide to answer questions about COVID-19 vaccines in children.